Hi, Dr. Randy Brown from Sunrise Medical Group to talk to you today about prostate cancer. Prostate cancer is a relatively common form of cancer in men, obviously. Some interesting information about prostate cancer. There were some studies, I think in the 80s, where on autopsy, men's prostates were looked at. These were guys that died from whatever, right? Heart attack, stroke, you name it. But they said, well, let's just check their prostates and see what we find. And turns out that in men age 65, about 60% of them had evidence of prostate cancer. These weren't guys that died of prostate cancer, they died from something else. But prostate cancer is pretty common when you're 65 years old. Lots of guys have it. So why do we care? There's a couple of reasons. First of all, how do we find it? How do you know you have it? So probably you don't know you have it. Most men who have prostate cancer have no symptoms. As prostate cancer progresses, you can have problems peeing, and you can have symptoms of peeing frequently, maybe some blood in your urine. But most of the time, it's not something you find because you come in with symptoms. It's something we help you find when we think that's the right thing to do. Why do we care? Well, there are treatments for prostate cancer, and that's a can of worms. There are all kinds of people who make recommendations on what's the right thing to do with my prostate cancer, right? And to be honest with you, I'm not sure that we know what the right answer is. If you have a family history of prostate cancer, it's important that we have a look and talk to you about prostate cancer screening. Prostate cancer screening historically was done by what's called a digital rectal exam, where the doctor placed his finger inside your rectum and felt of your prostate to feel for lumps or bumps. There's some pretty good evidence that that doesn't really help you find prostate cancer, so we don't routinely do that. Then the other test that is done, and still there's this huge debate, is the PSA test. Should you have a PSA test? And what does it mean? And this is where the real struggle is. The urology groups, the national urology associations, they think PSA is a pretty good screening test for prostate cancer. But they got a horse in the race, right? They get to take your prostate out and probably make some money at it. The cancer screening people, well, they're not sure. They think maybe in some patients. And then there's the U.S. Preventive Service Task Force, and this is a group of people who don't have an economic interest in whether you're screened for prostate cancer or not. They're trying to figure out what's the best test for you, and they really recommend against screening for prostate cancer. And I think that's important, and it's important that you understand why that recommendation is out there. You see, PSA was originally designed as a test to follow known prostate cancer. If you have prostate cancer, and we know what your PSA is, and you take a particular treatment, then we follow your PSA and say, it starts going up, your prostate cancer is coming back. That's what PSA is designed for. It's really not designed to be a screening test, and here's why. PSA has a normal range of 0 to 4. The problem is, you can have a PSA of 2, that's in the normal range, and have prostate cancer. Well, what if your PSA is 15? Well, as your prostate gets bigger with age, your PSA can go up. So having a PSA of 15 can be associated with just having a big prostate. It can be that you had sex the night before, or that you've been riding horses or rode a bicycle and irritated your prostate. Prostate infections are associated with elevated PSAs. So getting a PSA test, even if it's normal, doesn't mean you don't have cancer. And if it's abnormal, it doesn't mean you have cancer. So we really don't have a great screening test for prostate cancer. What we have to do is we have to sit down with you and say, what's your family history? What are you worried about? What do you want to do next? What do you want to hear from us in terms of the best way to go forward? So if you're worried about prostate cancer, we want to advocate for you. We want to help you understand what the risks and benefits of screening are. And if you have questions, talk to your provider. There's a whole lot of information about prostate cancer, and it may be something that is important to you. If it is, it's important to us. So thank you for using Sunrise Medical Group for your health care. If you have questions about prostate cancer, talk to your provider. We're here for your health. Thanks.